All right. Good afternoon, everyone. Happy Friday. Happy day after harvest, where we are still dancing on cloud nine after our fundraiser last night. And I'm so happy to be here with you, kicking off our November education segment. And we've got a great discussion today. So, my name is Erin Pellegrin. I'm our Senior Director of Culinary Nutrition and Education. You see me often in our education platforms, certainly here for our Ask the Expert segment. And I'm really excited to be joining you on this Friday afternoon. So today, our Ask the Expert segment is all about oncology massage. So for our passport holders, we know that this is a service that's available to our local members. However, this oncology massage is often part of the dialogue our community shares with their oncology team. And so we know that this is a unique form of massage. And so we're here to answer a lot of your common questions about what it means to receive an oncology massage, the benefits, when it may be appropriate, and how you can find someone in your area. So, a lot to cover today. We got a lot of questions already ahead of time, which we thank you, and we'll get through as much as we can in the time we have this afternoon. So, before I move forward, of course, first, I want to give a thanks to our education sponsors. We could not continue to bring you important topics and incredible experts like we are this afternoon without their ongoing support. So, today's Ask the Expert is presented by West, Merck, Lilly, Gilead Sciences, and Novartis. We have additional support from our gold sponsors, GSK, Pfizer, and Daiichi Sankyo, plus additional support from Tercera Therapeutics, AbbVie, and Veristem. So we are so grateful for their ongoing support, and we've got a lot more coming to you in the month of November. So let me share a little bit about what you have to look forward to. So after today, next week, we've got two segments coming your way. So Wednesday, November 12th, we have our virtual hangout. This will be at 5 p.m. Eastern Time on Zoom. And our topic will be life after cancer, thriving beyond treatment. And I will be joined by a fantastic panel. So Priscilla Fitzpatrick, that leads our Stronger Through Cancer, she'll be there. Kevin Hubbard, who's one of our mental health therapists, he'll be joining us, as well as Dr. Sabitha Pillay Friedman, talking all about relationship and sexual health. So we're bringing together a really great discussion to talk about after treatment. So again, next Wednesday, November 12th at 5 p.m. Eastern Time, followed by a really fantastic speaker series Thursday evening, November 13th at 6 p.m. Eastern Time. This is our beauty and makeup segment. So it is all about being confident and radiant, everyday makeup for feeling your best. And we will be joined by not only our beauty advisor, Jolene Hart, but makeup artist Rebecca Cashano, teaching all of us some tips and tricks. And we will be asking you to submit your beauty questions ahead of time. We know that this is a highly engaged subject, so we anticipate a lot of questions. So just to make sure we keep us on track, because I think so many of us could talk about beauty and makeup for hours on end. So a lot to cover next week. Of course, you can view all of our segments, including today's Ask the Experts, on our video library at uniteforher.org/UFH Connect. So with that, I'm happy to be streaming live on Facebook. Like I said, we had a lot of questions that came in from our audience already. However, if you're tuning in live, feel free to use that Facebook chat and pop in your own questions. We'll be watching that live dialogue, but we've got a lot coming your way. So it is my pleasure to introduce our expert today. So Lynn Rousel is a Lancaster, PA-based licensed massage therapist. She's a licensed esthetician and an NCBTMB, and Lynn, you'll have to tell us what these mean, but FSMTB approved continuing education provider, a real expert in this space. She's a longtime preferred practitioner and educator for the Society for Oncology Massage, the Society for Oncology Aesthetics, and Unite for Her. She's worked as a nurse for more than 35 years, as well as a massage therapist for 20 years, caring for individuals living with cancer and those who are medically complex and at the end of their lives. As a licensed esthetician, Lynn is certified in oncology skincare and is a certified end of life specialist through NEDA. A lifelong learner, she is passionate about teaching as well as mentoring fellow massage therapists and CE providers. So please join me in welcoming our expert this afternoon, Lynn Rousel. Lynn, thank you so much for being here.
Thanks, Erin. And just to let you know, it's Roussel. Um,
Roussel,
that's
thank you.
okay. You wouldn't have known. You wouldn't have known.
Wonderful. Well, we're so glad to have you here this afternoon. You have been with Unite for Her for so long, and like you said, do so much training and education. And we get a lot of questions from our community about the specifics of oncology massage. So, why don't we start with a nice sort of overview about massage and oncology massage in general and its safety during and after cancer treatment. So, is this something that anyone in our cancer space could look into?
Absolutely. Absolutely. Just important for anybody with cancer looking for massage to make sure that they find somebody that's trained in oncology massage, for the safety of the therapist and themselves as well. It's very important to do that. Sometimes massage therapists have a little bit of training in school, in massage therapy school, or maybe
Mhm.
they take an online class or, a couple hour class, but it's really important that the massage therapist is trained and confident, competent, and comfortable working with people with cancer. Yeah,
I love that. The three C's, it sounds like.
exactly.
I love that. Okay. So, what makes an oncology massage different than a regular massage or something that a person may have received in the past?
So the first thing is the intake form. It's going to look a lot different and it's going to be a lot longer than a traditional intake form. They're going to be asked a lot of questions, the type of cancer, the area where they were diagnosed, if lymph nodes were removed, or if they have lymphedema. They're going to be asked about the type of chemo and the type of radiation. And they're also going to notice that the massage itself is going to be lighter and slower or more gentle than
Mhm.
a massage that they might have had before. And the massage therapist is not going to do anything therapeutic. There's nothing that they are
Mhm.
going to try to fix or work on. They're just going to work with the person, to basically calm the central nervous system. That's the goal.
I love that. And I think maybe that message is often missed, really being clear about the goal of an oncology massage versus what we may, again, base our expectations off of past experiences. So I love that you just clarified that.
Yes, and a lot of people think when they take an oncology massage class, they're going
Yeah.
to learn a protocol for somebody with cancer, and it's completely opposite. As you know, everybody's different. So every single person's massage will be different based on what they're going through. And we have no protocols. I mean, I've been doing this for a long time, so I can I've got a lot of tools in my tool belt that I bring out, and some might look similar, but yeah, it's all about the individual and what they're going through and where they are in their treatment.
Amazing, amazing. So, with that being said, knowing that you're not taking a therapeutic approach, and we got a couple questions about this in particular. So, that would mean that a deep tissue approach, even to another part of the body that wasn't affected by the cancer diagnosis would not occur during an oncology massage. Is that correct?
That is correct. And the reasoning, there's a couple reasons actually. The biggest one is that the body is in healing mode. And so we don't want to
Mm,
give it anything else to deal with. Um, Deep pressure, deep tissue makes the body defend against itself. And
mhm,
so we don't want that. We just want to, be gentle. And another reason is a lot of people with cancer have a low platelet count, and so
mhm,
they could bruise
mhm,
easier. Their skin is compromised, so we try to keep them safe. The other reason is they might be at risk for lymphedema or blood clots. So we're just going to be very gentle. It's not, that we do have three pressure levels on the Tracy Walton pressure scale that we use. Um, Pressure one is the lightest, the very lightest. Pressure two is a little bit deeper, and pressure three would be like when people are used to having the massage therapist warm up their muscles per se, and that's the deepest that we would go. Yeah.
Okay. But deep is even using that word is,
Oh,
not right. Like we said, not like the traditional deep
right.
tissue that someone may be getting. So, okay. Okay.
Exactly.
So you mentioned risk of lymphedema. So I know sometimes a person will have an oncology massage, maybe there's a little bit of lymphatic work or lymphatic drainage. Is that part of the oncology massage umbrella as well, or is that even a totally different approach to massage in general?
That's a great question. Manual lymphatic drainage for lymphedema is
Yeah.
completely different.
Okay.
MLD, CLT, it's completely different. It's really not massage and it's not part of massage. So the only people that should be doing that, working with lymphedema, active lymphedema, are people that are certified, and
Mhm.
it's like 100+ hour certification, because we can really hurt somebody, cause lymphedema, or make it worse. Um, what we tell our students, my co-teacher Melissa Bond and I, if somebody has lymphedema, we don't touch it. If they're at risk for lymphedema, which means they've had lymph nodes uh, damaged, radiated, or removed in a certain area, on the coinciding limb, we
Mhm.
just do kind of like a light compression. There might be different ways that we work with an arm or a leg so we don't push lymph, in the area where the nodes were removed or damaged.
Mhm.
But
Mhm.
most of the time when I teach, I just ask people just to go light and slow on the area where the lymph nodes were removed, because we don't want to cause any reddening to the skin or any trauma to the skin. No deep
Mhm.
pressure, no thumbs, no knuckles, no hot or cold, because once you redden the skin, of course, the leukocytes, think, uh-oh, something's wrong, and they're
Mhm.
going to come rushing to that redness, and then it could cause lymphedema. So we have to be very careful with that.
Wow. And can you repeat one more time the certification that if someone were looking for a lymphedema therapist in their area, they might look for to know that person is properly trained?
Yes, they should look for somebody that's certified in manual lymphatic drainage.
Okay.
If the person is working with cancer patients, they probably have a MLD, CLT, um,
Okay.
so they can help manage that even when they're not having a lymphedema episode. But they can would you like me to tell you where they can find? Um,
I would love that. I was going to cover this at the end, but absolutely, if you have resources to share, by all means.
yeah, so if somebody wants to find a certified manual lymphatic drainage specialist, they could look at Monarch Continuing Education. They have
Okay.
a list of international MLD, CLT certified, close, Vodder, all the schools that teach
Hmm.
MLD will have a list of people. The other thing, if they can't find somebody, a massage therapist or nurse or PT in their area, they can always look up a lymphedema clinic that's close
Hmm.
to them and find a PT that specializes in MLD.
Amazing. Thank you. And I'm sure we'll pop the link to that website in the chat on Facebook so our viewers can access that if that's something they're interested in. Thank you for sharing.
Sure. Sure.
So we got a few questions, and this concern does come up quite a bit. So a few, I want to say more than a few, but several of our members submitted questions asking if massage could cause a person's cancer to spread, could cause it to move to lymph nodes or different areas of the body. Is that is that a risk?
No, it's not, thank goodness.
I know.
Because if it were, then oncologists would tell their patients, don't wash, don't put lotion on,
Mhm.
don't go in a body of water, which of course, moves lymph. Don't exercise, don't get the heart pumping. Um, it's a process that we don't mess with as massage therapists. We can't because, as you know, it's the heart that moves the blood and the lymph, not the
Yeah,
hands. So
yeah.
where if we are certified in MLD, we can move lymph if somebody has a lymphedema episode. But as far as lymph in the body when there's no lymphedema, we're not able to do that. Yeah.
Okay, wonderful. Thank you for clarifying that. And we got a question in from Facebook, just quickly going back to that deep tissue discussion that we had. So, for someone that may be interested in resuming a deep tissue massage therapy, are there recommendations in terms of when that might, how long they might have to wait after treatment before they may be appropriate to get a deep tissue massage?
No, because everybody is different.
Yeah.
Um, if you think of people, two people that are both dealing with breast cancer, one is just struggling, very medically complex, very frail, not exercising, uh, pretty unhealthy to begin with, isn't tolerating their treatments well versus somebody with that same breast cancer who is active, who's working, who's exercising, taking care of kids. They're two completely different people. So if they both say, when can I go back to deep pressure? It's going to be really up to them. So what I teach is no shorter than a year after they're out of remission or
Okay.
yeah,
Yeah.
inactive disease. But that might be different. That might be more for somebody. It just depends. And a lot of times people think they want the deeper pressure that they used to love before the
Mhm.
oncology massage, and now it's too much. So
Yeah.
we just kind of get back into it slowly. And there are exceptions. Like I said, one size doesn't fit all. So yeah,
Yeah.
just go
Yeah,
by.
I love that yeah, I love that you said no less than 1 year. Kind of gives us, okay, we kind of know where to start, but really taking that individualized approach.
Yes, yes.
Yep.
Yeah.
And I think when we think about massage, of course we think about relaxing and just sort of calming and sort of resting the muscles, all the different, really lovely effects we get from receiving a good massage, but can it also help with side effects a person may be experiencing, like pain or fatigue, or even something like nausea? Is that something that massage may be helpful for?
It could be. It again, it depends on the person.
Hmm.
Um, I always worry when people list things that oncology massage can or will help with because people sign up for that and they're really anxious. Oh, great, I've had this nausea. I'm going to get massage and it'll be better. Again,
Yeah.
it's up to the individual, but it absolutely can. It absolutely might, depending on, are they going to come on a regular basis? Can we, see them before they go to bed if they're having trouble with sleeplessness, or
Hmm.
fatigue, things like that. So absolutely, it'll just, again, be up to the individual. But there's lots and lots of things that oncology massage can help with. And
Yeah.
just to remind people, oncology massage can be anything. It can be, just scalp massage if that's all the person can take.
Mm.
It can be over the clothes massage. If they can't get on the table, it can be, in a wheelchair or a chair. It doesn't have to be a full body massage. And a lot of times that keeps people away from massage because they don't think they can follow all the rules. But it's, yeah, totally up to the individual what we can do with them.
And I love that you've reminded all of this of that, because I even had a member I was speaking with this morning, and she really wanted an oncology massage, but she wasn't able to lay face down because of post-surgical. And I said, oncology massage can be adjusted and altered to your comfort level. Right. And so I love hearing it could be just a scalp massage. You could
Yeah.
be sitting in a chair. It could be just, a particular part of the body or lightness, or the tailoring can be so individualized. I love that call out, because again, I think our perception is we go to what traditionally we think of when we think of a massage. So understanding that it is wildly versatile in terms of approach, makes it so much more appealing.
It really does. And don't forget the other thing that massage therapists can help with is stress management. So
Mm.
if the client comes to you and they're like, well, I really wanted a massage, but now I feel really nauseous, sorry to waste your time. And it's like, well, let's maybe work on some deep breathing, guided imagery, aromatherapy if you're trained, music, what would help you? You already have an appointment, so
Yeah,
what can we do?
I
Yeah.
love that. Yep, I love that. So good, so good. Okay, so when a person is going for a massage, should they be aware of, or are there areas of the body that a therapist would avoid or should avoid, that someone should know about?
Yes, so it should be in the intake form,
Okay.
asking, we would ask if they have a port. If they have, of course, radiation, where is the radiation being directed? Not that we would, you know, um, work with that person. There's lots of stuff that we teach, some rules about working somebody with external radiation, but in general, we wouldn't touch radiation burns. We wouldn't touch a port. We would stay
Hmm.
about 6 inches away. Um, and any other areas that the client lists, that might be painful. Maybe they have a rash somewhere, or just something's painful. Uh,
Hmm.
any area of the body that the client doesn't want us to touch or that we don't think it's safe. Sure, sure.
I love that. And I'm glad that you mentioned the port. That was a question that we got in from our community as well. If a person can get a massage with a port, and you're saying, yes, you would just stay further from the perimeter around that area and just work on other parts of the body.
Oh, absolutely. And also, if somebody is worried about being prone with a port, we can help with that with pillows or something soft between them and the massage table. So, or we could do side lying. I mean, whatever the client needs, really.
Yeah, I love that. I love that. I love that reiteration because I think we need to hear that, that it can just, there's so much adjustment that can be made to make a person comfortable. I think most of us just don't know that. So I love that you're just, reminding all of us of that.
Yep.
Now, for a person, for someone that may be new to oncology massage or they're sort of ready to explore this integrative therapy, is it best that they get a doctor's permission before seeing a massage therapist? Is that something that's mandatory, or are there situations when you might recommend, yes, you'll definitely want some clearance from your physician first?
There's never a time where somebody needs a doctor's permission or clearance.
Okay.
Um, as licensed massage therapists and the ones that are going to touch that person, it's up to us to be trained in oncology massage and know exactly the questions that we have to ask on the intake form and verbally to keep the client safe and to keep us safe. Most doctors have no idea about the effects of massage on somebody with cancer and vice versa. Um,
Hmm.
so it's if anybody in the audience has taken my classes, they know that that's a point of contention with me because a lot of times a physician will be used to getting a deep pressure massage themselves. And when they think of massage, that's what they think of. So they could say, no, absolutely not. Or they could say, yes, sure, you can have a massage, but the massage therapist isn't trained in oncology massage. So that's kind of giving permission, where I would, oh, okay, well, they said fine, and you want a deep pressure massage? Well, the doctor said, okay, you can have a massage, so let's do it. More better to communicate with the healthcare provider if needed than ask for permission or clearance. Yeah.
I love that. Yeah. And so many of our members will say, they are over communicating. They do like to share. So just, being able to share this with their team, and this is, something that they're incorporating into their oncology care. Yeah, it makes sense.
Yeah. Yeah.
For those that, another area, just going to, if there's a time that they need to avoid, for those that may be awaiting reconstruction, this was a question from our audience that came in. Even if a person has expanders, again, safe to receive oncology massage, you can work around that area.
Oh, absolutely. We can work around it. We can position them comfortably so they don't have to lay on their stomach or even their
Mhm,
side. There's always something we can do. The hopefully that person doesn't isn't looking for a traditional massage because it's not going to look like that, but it
mhm.
will still be good. They'll still receive the touch and the care. It'll just be a little different while they're going through that, but absolutely we can position and touch accordingly.
Amazing. Okay. And so, why don't we lean in a little bit more into what a person can expect during that first session, and maybe a little bit of guidance about what you would like patients to share during that, initial intake time. So, what can a person expect the process to look like for their first oncology massage, just to paint a picture?
Sure. I like to spend so I'm thinking it'll be an hour massage, maybe not, but let's just say it's an hour. It's probably going to be about an hour and 45 minutes for me to see somebody for the first time because I would go over the intake form with them and I'd look for you know, lymph node removal or lymphedema. Um, if they say that they're getting radiation, I ask on the intake form if it's external or internal.
Mhm,
If they're getting chemo, um, normally, there's different types of chemo. that can exit the body through the skin. So I would know that by asking if their physician or nurse has said that it could affect others, keeping myself safe. Um, allergies, nausea, just lots of things that they would be asked. Surgery, people that come for oncology massage are sometimes very nervous about filling out the intake form because they're afraid we're going to turn them away based on what
Mm,
they say. And if
mhm,
it's a trained oncology massage therapist, we will never turn them away. There are two reasons why we would turn somebody away. And uh, as you asked on the intake form or what we would be talking about, the first one is we ask if they have a fever. If they have a fever, or
mm,
if they don't mind us taking their temperature, or, just they look like they're just not real well that day, hot to the touch, blotchy, whatever. Um,
mhm,
we would send them or encourage them to go right to urgent care or make an appointment with their doctor to make sure, that they know why they have a fever and to take care of themselves and reschedule. Also,
mhm,
it could be unsafe for us if they have something like strep throat or pneumonia or
mhm.
something. So, the second reason we would turn somebody away, like right away, is if they have just had internal radiation, the radioactive
Oh,
gold, phosphorus,
yes,
right. So thyroid cancer, esophageal
yes.
cancer, some head and neck cancer, and
Mhm,
reproductive cancer, even prostate. It's very dangerous for us, of course, to be around somebody that is having that treatment currently. So sometimes clients forget about that, or they think, well, it's massage, things like that we've noticed.
mhm.
So not their fault, not their fault. They've got a ton of stuff on their minds, but
Yeah,
we wouldn't be able to see somebody that just had internal radiation. And there we would ask for a communication with the doctor to know when they're not radioactive.
got it. Okay.
Those
Yeah,
are really the only two. Um, you know, there's again always a way. If somebody, yeah, there's always a way to touch somebody or massage somebody otherwise.
yeah. Because I'm even thinking as you're sharing that, Lynn, what if a person just had surgery recently, but I go back to what you said, perhaps you get them comfortable and you're working on the scalp, and you're working on a different extremity really lightly, right? Like everything can be adjusted to an individual person. So I love that the door is so wide open for the oncology community.
Oh, absolutely. And a lot of massage therapists are used to turning people away because of contraindications. And
Mhm.
we want to just stop before we turn somebody away and think, what could I do?
Yeah.
Because turning somebody away is stressful, but more stressful when you're medically complex. And so they were looking for, the massage, and it's not going to be able to happen. Even I remember in massage school, we learned if somebody has is at risk for blood clots, which all people with cancer and cancer treatments are, just because of the disease and the treatments. Um, Blood clotting disease, things like that, we should, or surgery, recent surgery, we should turn them away. And I just say, why? There's lots of things we can do if we're trained in skilled touch. So
Mhm.
very rarely should they be turned away.
I love that. Okay. So, in this same vein, we got couple questions again from our community, looking at bone involvement in varying ways. So, one of our community members asked, "What about if someone has osteoporosis?" Right. So their bone integrity is compromised. Is there any risk to getting a massage? Or if someone has bone metastases and the
Mhm.
disease involves their bone, and maybe, there are other risks of fracture and other things that that individual needs to be aware of. Could massage be safe for those individuals?
It definitely could, and that's why we have the Walton pressure scale. For somebody with bone involvement or
Yeah.
osteoporosis, we would literally use the number one on the pressure scale. You know, the lightest, it could be just light compression, like Tracy Walton says, a hand sandwich, just, the lightest of touch. We're never going to stretch anybody. We're
Hmm.
never going to do range of motion, things like that. We're just going to be very gentle. Maybe they'll have trouble turning, because of the bone involvement. So
Hmm.
we're going to figure that out,
Hmm.
either at the intake or when it happens, because sometimes it's kind of surprise. Um,
Hmm.
but we can always work with anybody. We might have to bring out some props, some stools, some wedges, you name it.
Yeah,
Most of us that do oncology massage
you
have
have it. Yeah.
arsenal of props that we can use, pillows and body pillows and things like that. So, yep, we can work with anybody.
Amazing. I love that. And for those that are interested in bringing oncology massage perhaps into their integrative routine, there's obviously a cost that comes along with it. Is this a service that perhaps insurance may cover?
For the clients or
Yes.
okay.
Yes. Yeah.
That
Like if I, might my insurance company cover oncology massage?
that would depend on the insurance company. I know I
Okay.
keep saying things like that, but it would.
No.
In the past, it's hard to cover, but it does depend on the insurance. And I remember working with a teacher in Lancaster County, Pennsylvania, who had insurance for massage.
Hmm.
If she was deemed medically complex, and she was. So, but yeah, it would depend. It
Okay.
Yeah.
And I would imagine maybe for most individuals, it may not be something that's covered that they might have to pay out of pocket for.
Exactly. Yeah.
Okay. Okay.
Yeah. And I
So
have a
for the,
sliding scale for people with
oh,
cancer.
great.
Yeah,
Yeah.
and it's I'm not losing anything, or I just have a sliding scale because just working with Unite for Her, I know that some women would have not been able to get a massage, an
Mhm.
oncology massage, uh, if it wouldn't have been for Unite for Her, because it was free for them. So
Mhm. Mhm.
I understand that, and some people would say, well, I'm on my last, you know, uh, little square on my passport,
Mhm.
so I guess I won't see you again. And I kind of knew them by that time, and
Mhm.
just said, "Oh, let me think about that." And I
Yeah.
call a couple days later and offer them some type of, lower price
Yeah.
or
Yeah.
something that could work out.
Yeah, it's a good call out even just to ask, Lynn, and I'm sure
Absolutely.
a lot of providers would be open to that, just sort of understanding where one of their clients may be coming from and other financial toxicities, like we know cancer can be uh, for any patient, right? That some may offer that sliding scale option. So I always think,
Yeah,
it's worth it asking, it's worth inquiring.
exactly. Exactly.
Amazing. Okay. So to sort of wrap us up, we have at Unite for Her, we have a tremendous, very well accredited provider network of oncology massage therapists for those in our local area. But we know, we are serving those in all 50 states. So any guidance in terms of where a person, no matter where they are, may go to find a licensed oncology massage therapist in their area?
Yes, absolutely. Well, of course, they can go to uniteforher.org. You guys have a great provider list. Society for Oncology Massage. also has a preferred provider um, finder on their website.
Mhm.
Um, and oh, healwell.org would also have that
Yes,
too. So those are three
great.
great resources.
Amazing. And similar to the credentials you mentioned earlier for certified lymphatic therapy, or lymphatic drainage, or lymphatic therapist, I should say, are there credentials that someone might look for their massage therapist as well?
Um, Basically just that they're trained in oncology massage.
Okay.
Otherwise, I know some people are thankful that some of us are nurses or have worked in the
Yeah.
medical field, PTs, PTAs, just because some people think that they're safer, but they're not. If you're a trained oncology massage therapist, then you would be fine. Yeah.
Amazing. Wonderful. Well, great resources. And I know we had someone that reached out in our questions for our Ask the Experts, just inquiring about becoming a provider with Unite for Her. So you can always reach out to info@uniteforher.org. And Melissa Christie, who leads our wellness program, can certainly get that process started, get connected with our advisors, and can share the information that is required to be one of our providers. So we had some inquiries about that, which is great. But with that, Lynn, you shared some really great information. I think you provided actually a lot of clarity about oncology massage, what it is, what a person can expect, and frankly, how versatile it is for anyone in the oncology space and how it can be adapted to them, which I'm sure our viewers appreciate. So thank you so much for being here and giving all of this information and knowledge about oncology massage. We are grateful to you, and frankly, thankful that you are part of our provider network.
Well, thank you very much for the opportunity. It was a lot of fun, and I hope I was some help.
Oh, a lot of help. Thank you so much.
Thank you.
Wonderful. So, a lot of information shared, and so many great tools. Hopefully, this is providing some reassurance to those of you that may be tuning in and were curious about oncology massage, but unsure if it might be right for you. Clearly, we know it can be. So, we've got great resources on where you can find someone in your area. Our segment today is recorded, so if you want to share this recording, it will be available on our UFH video library. So you're always welcome to go back and rewatch it and share with those that may be curious about this integrative therapy as well. So as we wrap up this afternoon, first, again, I want to give a big thanks to our education sponsors. So today's Ask the Experts was presented by West, Merck, Lilly, Novartis, and Gilead Sciences. We have additional support from our gold sponsors, Pfizer, GSK, and Daiichi Sankyo, with additional support from AbbVie, Tercera Therapeutics, and Veristem Oncology. And again, today's Ask the Experts with Lynn just kicked us off for the month of November. So don't forget, next week we have our virtual hangout, Wednesday, November 12th at 5 p.m., Life After Cancer, Thriving Beyond Treatment. And our speaker series on Thursday, November 13th at 6 p.m., Confident and Radiant. So we'll be learning everyday makeup tips for feeling your best. All of those, again, will be recorded. So if you can't make it, tune into our video library. But with that, I want to thank all of you for joining this afternoon. Thank you so much for submitting your questions and for watching along. Thank you to our expert, Lynn. And hopefully we will see you again soon. Have a great weekend, everyone, and take care.